Fair Health, and I'm going to go through the first part of some slides to introduce you to Fair Health and what we do. What we're going to do, I think, is stop to make it easy to answer questions in this format, stop at a couple of different points, at good breaking points within the presentation, and then we can take questions at the end as well. So don't worry, we will get to your questions. Okay. We're just fiddling with the screen here for a second. Oh, sound isn't working. Okay. So today we're going to go over just a little bit of the background about Fair Health, who we are, how we came to be, talk about sort of the role we play in the health insurance industry overall, introduce you to our consumer website if you're not already familiar with it, and talk to you about some new plans we have underway, give a demo of the website, and then talk about how you may want to take advantage of some of the tools that we have to offer as you're working with your clients. So, okay, so a little bit about the origins of Fair Health. We were started just 2 years ago as a result of an investigation from the New York State Attorney General, and basically physicians were challenging out-of-network reimbursement and the amount of reimbursements they were getting, and they were challenging the insurance companies that they were not reimbursing fairly. So at the time, Andrew Cuomo was the Attorney General. He started an investigation, and they really looked at a few different things. So starting from the right-hand side of this screen, they looked at the potential inequities in out-of-reimbursement formulas. They really looked at the fact that nobody could really understand how health insurance companies were setting their rates and how they were basing their reimbursements. And then the company that was offering the data that was used to set these out-of-network reimbursement rates by the insurance companies was called Ingenix, and it was wholly owned by United Healthcare. So that really led to a lot of questions about this. So the investigation actually never went into the complete investigation phase. It was really determined that just that conflict of interest with Ingenix being owned by United Healthcare was too much of a conflict, and that something needed to be done. So there was a settlement agreement that resulted in the in establishing Fair Health. So they collected $95 million from the insurance companies, from the major insurance companies in New York State, and they used that to establish an independent nonprofit organization, which is Fair Health. So we came into being in the beginning, at the end of 2009. 2010 we really used to sort of set up our infrastructure, and then sort of got up and running and distributing data and products and our consumer message in 2011. So we were charged through the settlement agreement with three things: to create a new enhanced database that would be used by the insurers to manage their out-of-network reimbursements and to set their UCR formulas; create a consumer-friendly website so that consumers could have a window into seeing how the insurance companies were setting these reimbursement rates; and then also to promote academic and health policy research. Is it this one? So needless to say, we didn't get the whole $95 million in the settlement, but we got some of it to get started. But we have a lot of different stakeholders. We're sort of what my boss likes to call the nonprofit, or the duck-billed platypus of nonprofit organizations, because we sort of stand in the middle. What we do is we offer a window into the data about what people are, what doctors and healthcare facilities and dentists are charging for healthcare services, and then we make that data available to a diverse range of stakeholders. So of course, healthcare consumers through our website, the payers, insurance plans, health plans are using our data to set the usual, customary, and reasonable rates that they base reimbursement on. Healthcare providers are using the data in myriad ways, and we'll talk about all these different ways. Healthcare analysts and consultants, bill review companies, large employers, TPAs and unions, government officials and policymakers, researchers, and of course educators and advocacy groups such as yourselves. So talk a little bit about the data to give you a feel for what we have, and then we can talk about how different organizations are using it. So basically, our information includes charge data from providers from 2002 to the present. So these reflect the actual bills that healthcare professionals are charging for procedures and services around the country. And the database reflects all areas of the U.S., and we have it divided up into 491 distinct areas so that you can get pretty granular when you're looking at healthcare charges in local areas. You can look at it based on, what we call a geozip, which is basically defined by the first 3 digits of a zip code. So you can look at what providers in a local area are charging for each procedure. And the data represents the claims experience of 126 million people covered by private insurance. So we're just collecting claims in the private insurance space and not from Medicare or other, other governmental organizations. It's private health insurance. We have once we collect the data, it's sort of overseen by academic and scientific advisors to help us apply methodologies to make sure that we're using, that we can go into the data and exclude outliers and invalid data correctly, and so that we're really showing what's really applicable into the, as we provide this window into the data. We currently have over 14 billion billed procedures in the database, so that when you're going to the website and when you're looking up your costs, it's really representative of what is going on in these local areas. It's the largest private claims collection in the country. And let's just go to the next one quickly. So the data comes from the insurance companies. So as part of the claims process, providers, doctors, hospitals, dentists, they submit their claims to insurance companies, and as part of that process, they submit their full undiscounted rate. So once the insurance company begins to process that claim, they will go in and look and see if that payer is, or that provider is part of their network, and then reprice accordingly. But what's coming into the database and what we're reflecting in our data and on our website is what you would go and what the doctor would bill independently of whether or not they participate in an insurance plan. So we have as I mentioned before, that our database represents 125 million covered lives in the private insurance system. So it really is a very robust database that we're using. And I think so. These are the different ways that the Fair Health data can be used by some of our different stakeholders. So kind of front and center up top are consumer tools and education. So that's the website that we're going to demo for you shortly. But we were also talking about providers and how they might use it. So healthcare facilities and doctors might use it to develop ACO models and bundled payments and to figure out how they're going to participate in there. Providers may develop their fee schedules using this data to understand what the market rates are, or when they're negotiating to participate with health plans to find out, what's the market rate versus what is this health plan going to pay me. Lots of government agencies are using it for reimbursement data centers to look at essential health benefits under healthcare reform, all payer databases. One of the biggest uses by the insurance market is out-of-network reimbursement schedules. So they're looking at our data to find out what the market rates are, so that when they're paying out-of-network claims, they have a feel for that. Now, they don't. Our data is not Fair Health doesn't put forth our data as a usual customary schedule, but many insurance companies will use that data as the source to set their out-of-network claims. Health economics and policy research, that was one of the mandates that came out of the settlement agreement, and in June we're going to be launching a brand new research product. States are using it also for workers' compensation fee schedules, auto liability fee schedules. Employers are using it for managing their health benefits administration, managing high deductible plans, and helping plan participants better understand and get access to costs when they have more decisions to make as part of a high deductible plan. And then, of course, really the crown jewel of it all are the consumer tools and education. So one of the things that came out of the settlement agreement was that 12 insurance companies in New York State were mandated to use our data in their out-of-network reimbursement areas. But it didn't really mean anything for anybody outside of New York State. So what we had to do is go out and approach insurance plans, bill review companies, TPAs, employers, unions, and all of these other organizations, and talk to them about licensing our data. And in the end, this sort of commercial way that we use our data is what funds our outreach on the consumer side. So while some of the plans in New York State were forced to use the data, we have a lot of voluntary relationships too, so that we go out and have meetings with these companies and try to basically sell them on our data and why they should use it. So I think it really reflects how successful we've been in just the year and a half that we've actually been distributing these products, that we've got almost 500 payers using our data in their health insurance plans for their out-of-network reimbursement or in other manners that we just talked about, and that our contracts with these payers and other companies are touching 175 million lives covered through the private insurance system. So in just a short amount of time, we have really gained quite wide acceptance and become part of the national conversation on cost transparency and integrity. So we're really proud of that, and then I think what we're going to show you is how our website really brings that to consumers. So we offer a consumer website, and we're going to go through it, but it offers educational content and then the ability to look up what actual dental and medical costs will be in local areas. And as I mentioned before, so through the settlement agreement, through Governor Cuomo's interest in this, I think originally it was expected that we were going to be working in sort of the out-of-network reimbursement space. But we've really come to find that we have a lot more to offer than just that, because our tools are very useful to the uninsured to help them understand what the cost of care is going to be for them. And also, even by people that are staying in network but are covered by high deductible health plans and have high deductibles, they're going to be very interested in making decisions about whether they want, how they want to spend their money, and understanding in advance what things are going to cost. And then also helping people understand what the costs are in advance so they can make those decisions about whether they want to stay in or out of network. And then I think, we've been getting a lot of attention lately, too. We were featured in this morning's Crane's Health Pulse. We were in the New York Times on Monday. So we really are becoming part of that national conversation. And so now what we like to think is that we're really connecting the dots. So the payers are using our data, to adjudicate claims. Employers can use the data and help them manage these high deductible health plans. And now the consumers have some tools where they can understand what the costs of care are before and after they incur the expenses. So consumers are using the website in lots of different ways to learn about the reimbursement fundamentals and learn how insurance works. It's very complicated, as you all know, and it's very difficult to navigate from the consumer perspective. We have a page to help them find key healthcare resources, and we're adding resources all the time. So, you know, if we have resources that we're missing on there that you think we should be included, we'd love to hear from you. It helps consumers obtain cost information. It helps with the in and out-of-network decision, managing high deductible plans. And then using the information, too, is I think many of you may be using it with your clients to help negotiate the cost of a procedure, either up front or after, you know, especially depending on how much the insurance company is going to cover versus what the individual is going to have to pay out of pocket. And then we've seen it used also to help with the appeals process when they're going back to insurance companies with the appeal. So these are all different ways to use the data. We're going to go in next to a live demonstration, but I wanted to stop here and see if you have questions at this point that we can answer, and then Cynthia is going to go in and do a demo of the site.
Hey everyone, so I actually have you all in listen-only mode, so if you have a question, you can feel free to go ahead and chat it in. We're going to have a second moment in the presentation to answer questions that have been chatted in, and then at the end of the presentation, I'll unmute everyone so that you can ask questions vocally. We do have some folks here at the table who are going to ask some questions now, and if you have some now, go ahead and chat them in and we'll get them answered. So Sam, you have a question?
I do have a question. You can tell, actually.
Speak loudly.
So you said that your database is based on the rates submitted by the providers to the plans?
Yes.
And so obviously when, let's say the doctor is in network, let's say the colonoscopy, and they submit $4,000, the in-network rate might be $2,000, and that gets paid, and that's what the doctor accepts. Do you have any data on the in-network reimbursement rates that are being paid? And if you do you plan on using that data in any way?
We do have one of our modules that we license is what we call the allowed module. And so that basically has what they paid, so whether it's in-network or out-of-network, but it comes very close to the in-network because, you know, so much of a greater percentage of claims are paid in-network versus out-of-network. But it is blended, you know, between all the insurance companies that are contributing the data. So we are not currently providing the window into that for consumers because it's sort of irrelevant to them on a blended basis because it really matters what their, you know, what their insurance company is paying for the in-network. And you know, truthfully, when it's in-network, they have less of a, you know, stake in it. But we do make that data available to our commercial clients.
And so when you say that commercial clients are relying on Fair Health data to set out-of-network rates, some of them may be relying on the allowed module, some of them may be relying on a different module. So even two plans that are using Fair Health data might be using two different Fair Health data sets. Is that accurate?
It is accurate that they can use different Fair Health data sets, but generally they will use the allowed module for different purposes. So they may use the allowed module to sort of get a feel for how are our network rates matching up to this blended sort of overall. So more to negotiate and determine their in-network schedules. You know, for out-of-network reimbursement, they're generally using the charge benchmark data that represents the full charges of the providers. And then we offer like several different versions of that. So we offer a medical surgical that has all the professional fees. We offer in-network and you know, inpatient and outpatient facility modules that they're using, anesthesia modules, and some of these, right now our website reflects the professional fees, and we're adding, you know, slowly as we go. So you'll see one of our next additions to the website over the coming months is going to be adding anesthesia fees in.
So it would be added into if you go and get a colonoscopy and you put in that CPT code, the rate that you see would include the anesthesiologist.
We'll actually show you a demo of that. For that particular example, it does. If you were to go in and just search for an anesthesia code today, just out of the blue, it would not show up because that hasn't been added. But what we have added is anesthesia related to certain common procedures is currently on there. So it's, it's a stage-by-stage process where we want to make sure that we add it, and we add it in a way that is consumer-friendly and, makes sense. We can talk more about some of the complications of that, but we are adding that over time. But today the consumer site includes the professional fees. Are there any other questions right now?
I don't see any questions chatted in, so I
have another one. Why don't we go through the web demo, because that may answer a lot of your questions first, and then we'll break there again for more questions.
And again, guys, just feel free to type in your questions as you go along, and we'll answer the next batch at the next break, or you can hold questions to the end when I'll unmute everyone.
Hi, everyone. I'm Cynthia Mullane with Fair Health, and Chris and I are tag teaming today with our presentation. So I'm going to go ahead and give you a live demonstration of our consumer website, which is fairhealthconsumer.org. And this website is available for free to consumers for you guys to help your consumers. And we really are excited to share this tool with you because it really shows the hard work that my colleagues have been up to over the past couple years. And so first of all, I just want to give you a sense of what the website looks like. We've got some background information on who we are. We have a whole glossary of terms because we don't assume that everyone understands every archaic term in the health insurance industry. And we also have a list of healthcare resources where if your organization is one that we should be listing, feel free to send us your information. And then we also have our educational materials, Reimbursement 101. And we wrote these using a number of consumer literacy experts, and we wanted to put health insurance information in such a way that it wasn't overwhelming or confusing for consumers. And we didn't assume that even a PhD would understand everything, because I know all there is to know about health insurance, and I still sit there with my eyes glazed over when it comes time to pick a new plan for the year. And so we just assumed that everyone was starting with the same questions in their mind, and we wanted to make it easy for them to understand. And so this is not a static portion of our website. We continually refresh it as we get new information or new things are happening in the marketplace that we think would be helpful to explain to consumers. For example, over here on the left-hand side, you'll see the role of Medicare and out-of-network reimbursement. And that's something we've added as we've been hearing from consumers and now hearing in the media that plans have shifted, some of them, to using a percentage of Medicare for their out-of-network reimbursement. And so we've added consumer materials to help consumers understand what that means for them, but we also, which we'll show you in a minute, have allowed consumers to find out if they know what percentage of Medicare their health plan reimburses at, they will be able to see that amount in our cost lookup tools. So in your materials, if you were able to get them from Ashley, there's an overview of all of our Reimbursement 101 segments, and that should really help you understand what we have and what we may be adding as time moves on. So let's start with our consumer cost lookup. We'll go with medical, and we've made this portion of the cost lookup. There's a very simple way to do it, and then there's also a very specific way. We'll go with the simple just because I don't have CPT codes memorized. So, so what you'll do is you put in the location of the service or procedure, so the zip code of where you would get the procedure done. Since we're in Manhattan, I will type our office's zip code. And then you could type in the CPT code if you knew it, or you can scroll down a little bit. And we worked with a Robert Wood Johnson scholar to develop this taxonomy, so it would be easy for consumers to understand. And Sam, since you brought up colonoscopy, we'll go with that one. So colonoscopy is a normal screening procedure for a number of older Americans, so we'll go with colonoscopy. And it will also touch on your question about anesthesia, Sam. So we have a terms of service agreement that everyone needs to click through and say they agree. And also in here, it identifies that we have limits on how many times a consumer could use our cost lookup tools because we license these CPT codes from the AMA. So we're paying for these to be used. So I believe the limit is about 20 procedures per week. God help the person who needs more than 20 procedures looked up. But because many of you are helping people on a day-to-day basis, we can get you a waiver to use this in an unlimited basis. So my email address is at the end of the presentation, and I'll make sure everybody has it so you can just give me your IP address, and we'll get you set up. So let's see. Should we do a biopsy of large bowel using endoscope, Chris?
Our favorite.
Yes. So you'll see over here, these top 3 options have this plus sign to the right. And that plus sign is indicative of our shopping cart procedure, which if you're getting this biopsy of a large bowel, you also are likely, oh, excuse me, we'll do a diagnostic examination. Would that make more sense? I am not a medical professional. I just play around one right now. So we'll start with this diagnostic examination on the colonoscopy. But it will help in the next screen to understand what that plus sign means. But we have this question at the bottom here. Are you insured or uninsured? And this is helpful because if you're uninsured, we take out any cost-sharing amounts that we might put in. So the uninsured person gets the full cost of the procedure since that's the bill they would be subjected to. And so on the next page, we will have our estimate. And so here is the provider's fee, the estimated charge, about $1,800. And here's an estimated reimbursement from the health plan. Oh,
Here's our survey.
here's our survey that our colleague Nicole has worked so hard on to get information from our consumers. And so here's the estimated reimbursement from the health plan and the out-of-pocket estimated cost for the consumer. But with the plus sign, what you may not know when you're going in for your colonoscopy is that you also will likely have anesthesia, and that has its own cost as well. So we have the CPT code associated with that colonoscopy, and that is a shopping cart procedure, we call this, and it's our estimate assist. And so now you can get a better picture of the cost that you have for your colonoscopy.
And obviously this helps patients. So, you know, you're going in, you know you're going to the doctor, but you never thought to ask. You know, you just assume everything comes together. But it's all billed separately, and it's all, you know, sort of under the radar. And anesthesia costs are one of the things that takes most consumers by surprise, whether it's part of an operation or a simple colonoscopy.
Mm-hmm.
And with the colonoscopy, would there also be a surgery center charge?
That's another piece that we're looking to add in the future. So this data just includes the professional fees. So obviously, if it takes place in a hospital versus a doctor's office versus you know, an ASC, the fees may be the same. So that is something that we are working to add over time, but currently it doesn't. And we try to make that as obvious as possible in the explanatory text and in the printouts that you get with this.
And as I've been moving through the cost estimate, I haven't hovered over all of our terms, but each of those terms that are underlined have some text that when you hover over it, it helps explain what they are. Sorry, you have to click on them. And so here's an explanation for the consumer of what the estimated charge is. And so for each of these, it would help them understand without having to navigate away from this cost estimate page of what these terms are. And so we have been basing these estimated reimbursements on the 70th percentile of the Fair Health data. And so what that means is we are taking all of the charges in our database in the Manhattan zip code, so everything that starts with 100, and we've arrayed them from lowest to highest. And this number here is the amount that 70% of the doctors in this area are charging, that amount or lower.
The $17.99.99.
Yes. And so if you know what your health plan sets their UCR at, it might be the 80th percentile of Fair Health. And so you can adjust this percentage here.
Actually, yeah, just one second.
Oh,
There's actually two sliders here. So sorry. So this first one, adjusting the reimbursement percentage. If you notice that it was at, that when we had it at 70%, this is 70% of the reimbursement.
Oh, okay.
So that, sort of our default is 70% of that plan will reimburse 70% of the cost. So that's what this slider is for. Now, for people that are sophisticated and go into the depths of their plan documentation, they can use this advanced charge estimator at the bottom.
I was getting ahead of myself.
Yeah.
There we go.
So if you click on the advanced, okay, there it is. So that represents the percentile that the data, the estimated charge is based on. We sort of keep it closed because 80th percentile is very commonly used for this. We don't want to confuse people overly, but it is there for people who understand to that level of what they want to look for.
So the first slider is the cost sharing, and the second slider is the percentile of fair health charges.
So the first one is going to help you calculate the co-insurance,
Correct.
Cost sharing, and then the second one you'd have to know how your plan is doing this.
Right.
Got it.
And the first one is going to be something that's based on the terms of your plan. So every plan says for out-of-network, if they pay 70% of UCR, or 80%, or 75%, or 60%, and that's the rule you live by. So that first slider allows you to adjust that.
Right. And that, I won't say most, but I think that's a number that a lot of people are aware of, and when they're making their decision whether to go in or out of network, that's going to be a key resource.
So just so I'm clear, the three categories, the estimated charge is what the doctor would charge, the reimbursement is what they are reimbursed by the insurance company, and
No, the estimated reimbursement is the estimated charge times the percentage that you put on that slider.
Right.
So if the insurance company pays 80% out of network and the insurance company bases it on fair health data, then yes, the estimated reimbursement would be what the doctor would be paid. Does that make sense?
No, I can.
Okay.
The out-of-pocket cost is to the consumer.
Yes, yeah. So I think, so you have what you can expect to be charged for that procedure by the doctor. You have what you can expect to get back from your insurance company, given these defaults and assumptions, and then the out-of-pocket cost is what you would have to pay, or what you want to try to negotiate with your doctor that you don't have to pay.
Is there a list on the site of the 12 insurance companies mandating financial status? You mentioned
there are 12 in New York State. It's not on our website. You can go to the settlement agreement where they are listed. But when you think about it, so we do have those 12, but over 500 insurers and TPAs are using the data. So it's very widespread that this data is in use. So and there's no guarantee that a company is going to take, an insurance company will take our data and just say our UCR is, 80th percentile. They may manipulate that. They have the right to set their own UCR rates. We're very careful to say that we don't set the rates. We offer the data, which is used by many companies to set the rates. But it is at least a discussion point, and many companies do use it that way and just pick a percentile and set their rates that way. But yeah, so you can get the list of the 12 in New York State, but with over 175 million people covered, under people that we have, under companies we have contracts with, this is pretty wide, pretty good estimate and tool to use.
But as you may have read in the New York Times or in USA Today a few weeks ago, there are some plans that use a Medicare-based reimbursement schedule for their out-of-network claims. And so because of that, we were hearing from consumers, I'm so confused, I don't know where these numbers are coming from, I didn't know this. We recently rolled out our Medicare-based cost lookup. So consumers with a Medicare-based plan can now use this. So here we have our colonoscopy with anesthesia, but we've switched to a Medicare-based reimbursement. And so you can see if your plan, one of the common amounts is 140% of Medicare. And so we have this slider tool so the consumer can figure out what their plan has. And so as you can see here, this is now the estimated out-of-pocket cost, assuming that the plan is reimbursing at 140% of Medicare.
And currently what you see now is that estimated reimbursement is based on 70% of that amount. What you'll see next week is we've added another slider to help make that change. So we're just kind of finalizing that in our development site right now. We have a meeting this afternoon to see if we can approve it to go live tonight or if it's going to be next week. So
That's really cool.
Yeah.
And so in order to use this tool correctly, first you have to go to your plan documents and figure out how your plan is setting these rates, basically. So you have to know, you have to be able to look in the plan documents and figure out my plan's going to use 140% of the Medicare rate to reimburse out-of-network providers.
Right. But some plans in the summary plan description, it doesn't necessarily define what UCR is. It might just say UCR, and it may take a phone call or a couple phone calls to find the right person and get.
And I'm sure what you'll see, because we're getting calls about this all the time, is that this is something that is very much under the radar, that even consumers that know that their plans are charging, are basing it on 140% of Medicare, well, that sounds great. That's better than 80% of UCR. So that there is a lot of misunderstanding there. And even some of the CSRs are not aware of, when people call the insurance companies, they're not aware because, this is sort of a fairly recent trend that some companies are trying to use this. Based on a New York Times article from a couple of days ago, maybe they'll start moving back because they don't like that kind of focus on them. But, but this is something that most people find out after they've gone out of network, and then they start like, how come I only got, this much back based on, on that kind of a charge. So, it is, you'll come across it a lot, I think, in your work because it is an issue that's becoming more and more important and very frustrating to consumers, and they have to really go into the bowels of the health plan documents to find this information.
And so just so we can really get a full picture of what a switch to Medicare would mean for a consumer. Here's your out-of-pocket cost for a UCR-based reimbursement, $720, or for the same procedure, a Medicare-based at 140% of Medicare, over $3,000. So you can see why the consumers in the New York Times article this week were very confused, and it just really, I'm sure you guys, if you're hearing this from your consumers, it's just as similar, where did this number come from, why do I owe so much? So, and are there any questions, or should we move on into how you guys can be using these tools in your work?
And just, I don't know if you end up ever working with people that are trying to access dental coverage, but we have a similar lookup on the dental side where you don't have the Medicare piece of it there, obviously, but you can estimate your dental charges. And what we're finding from our web statistics is that many people are using the dental cost lookup also because out-of-network is much more prevalent on the dental side than it is on the medical side.
On these CPT codes, the data that you get based them on, is there, there's some procedures, maybe, for example, if you have a pediatric heart surgeon versus an adult heart surgeon, there are many fewer of them, and would that data be skewed differently? Is it all averaged?
It's really
So the question that Steve posed is, if, for example, you're getting a procedure from a very specialized provider, for instance, a pediatric heart surgeon, so there won't be as many providers in the area from which you can draw data from. Is that going to skew Fair Health data when looking up what your out-of-pocket cost might be.
Yeah, so basically we report this based on the number of claims we get for this procedure. So it's going to be blended. But what you'll see is if you're a sophisticated user of this, so based on the 80th, if you're at the 50th percentile, that might not be those kinds of specialists charging sort of that mid-range charge. But if you move that advanced charge estimator up to the 90th percentile, you might end up seeing closer to what, the higher charges that those, real specialists would charge. So it's sort of a sophisticated use of it because the way the data is presented, we don't distinguish by who is submitting the claim, but you can sort of game the system to get a better feel for it.
We do have a question from Alexandra. The question is, how would a Medigap help with the difference in cost? So I'm going to answer this. So these tools are really useful for the commercially insured population or for the uninsured population to figure out what you would be paying to a provider. Your question is about someone who is on Medicare. This wouldn't necessarily be the first tool that I would use to figure out what someone on Medicare might be paying. There's a tool on Medicare's website that you can actually use to try to figure out the Medicare rate for a claim. And so if you bought a Medigap, then you would have a commercial insurer paying your cost sharing, so you hopefully wouldn't have much out-of-pocket cost. But in terms of how Fair Health would assist or work with a Medigap, it's not really pertinent to that population.
And what we have tried to do, because once you see the word Medicare, people covered by Medicare and older population, this tool is not for anybody that is on Medicare because it's really covered for that. It's just the privately insured consumers that are covered by a plan that bases reimbursement on Medicare fees.
So it's common. A lot of people, when they get a surgical procedure, they actually have multiple procedures at the same time. Mm-hmm. And we see with our consumers that obviously insurance companies make reductions if you're having multiple surgeries on the same day, because they say the prep work, you only have to prep them once, you only have to clean them once, you only have to meet them. It makes some sense. And there are these reductions applied to the second procedures, and I find that some of the difference between the reimbursement and what the doctor is billed, some of it comes from a difference in rates, but often a lot comes from a difference in these reductions. And I wonder if you guys have any tools to help us navigate what are fair and reasonable reductions.
Right. So sometimes those changes are reflected in a separate procedure being billed. So there might be a separate procedure, for instance, for a second surgeon assisting at a surgery, in which case that would be billed through that separate CPT charge, and you could back into it that way. In some instances, it's accounted for by modifiers on the initial claim, so that there will be a claim for a CPT code, and then the modifier will indicate this was performed in conjunction with another. And when it is, for that, it gets blended in, because we basically, at this point, are reporting based on the high-level procedure code, and we don't have the ability to distinguish the modifiers. But some of those procedures are billed through, if they're correctly billed by providers. Sometimes, there's some gaming of the system going on. Sure. But if they're correctly billed, it would be billed under a separate code or using the modifier.
And in the allowed module, would that account for modifiers?
The allowed module, again, there is more flexibility in how commercial, users of the data might use it. So they have the ability to go in and look if modifiers apply or not, and decide how they want to use that data, if they want to use it separately or not. But in general, the way our benchmarks are arrayed, there might be a benchmark in that commercial data that is based on the modifier, and then data that's not, based on it without the modifier.
Doesn't look like we have any other questions. Feel free to keep chatting your questions in, or if you'd like, you can hold them to the end when I'll unmute everyone, and we will continue.
And so now that we've given you a demonstration of our website, we wanted to share with you how you and your colleagues could use our consumer site, and also let you know about what we have planned, because our site is not static. We want to always respond to changes in the marketplace, consumer questions, and things like that. So we welcome your recommendations and suggestions as well. But on the plans for this summer, this summer and this fall, we have a Fair Health Consumer in Espanol site planned. And so I know that we have a number of Spanish-speaking folks who call our call center at times, and so we also want to just allow a lot of our information to be available to them in Spanish. We will also be adding our Fair Health Estimate Assist for dental procedures, and that's the shopping cart scenario. So if you were having a root canal, it would also suggest anesthesia or other associated procedures as well for dental. And we always add new Reimbursement 101 topics, and so we have some of those that are planned for the rest of the year. And we will be adding more data to refresh our consumer site, and that includes anesthesia. So right now we just have anesthesia available when it's associated with some of our shopping cart procedures.
Yeah, just as a matter of interest, so we are adding these new Reimbursement 101 topics, and we work with health literacy experts, and we work we work with experts in the field. So, for example, Nicole here just wrote an article about anesthesia recently, because that is one of the most confusing pieces of the puzzle when consumers go in. They go in for an operation and they're billed for anesthesia that they never expected. So Nicole wrote an article. We had it reviewed by the Anesthesia Society of America, and NYU Langone has actually posted that article on their website, because they find it's a problem where they're always trying to explain, why it's billed separately and how it works. And so they, all sorts of different stakeholders find different ways to use our information in ways that helps them. So we were really sort of proud of that, and then it helps, it helps the hospital as they're working with their patients, try to minimize billing questions so that they can understand this up front, and they're referring their patients there.
And so because we are constantly updating our website and making it work better for our consumers, we also have a number of ways that we engage with consumers to get their feedback. And so as you saw when we were showing you a demonstration of the website, our consumer site survey popped up, giving us the opportunity to take it. And in there we have ways to ask them, get both numerical information as far as how helpful is this and what information did you get. But we also have text boxes where they can give us their comments. And we can really get a window into what their experience was with the website and what their questions still might be. We also have a call center that for those who are unable to use the website or need a little bit more help, we have a number of well-trained folks ready to answer the phone at our call center and help walk them through the website. And we also have our contact information at the bottom of every website page, and you'll see it here at the bottom of this slide. So people can interact with us in a number of different ways and let us know what they're thinking of the website. We also have ways that we are doing outreach to consumers. One way is demonstrations like this, so you guys can use it in your work and tell your clients about it. But we also have a quarterly newsletter for our consumers that Nicole writes. It's our Fair Health Consumer Access, and it really highlights the educational materials and information that we're putting out there about health insurance reimbursement to help our consumers just get a better understanding. And we also use a number of social media platforms like Facebook and Twitter and YouTube to do outreach there, just because we want to make sure that we're hitting consumers where they are. And so if we read an interesting article about something, we'll post that to our Facebook wall and also tweet that, so the folks that follow us are getting real-time information that we are seeing as well. And so some of the ways that you and your colleagues can use our tools: you can provide your consumers on your website, you can link to fairhealthconsumer.org, and we have pre-formatted links, so if you just want to use what we have, that already describes our website, you can do that, or you can write your own. You can also, of course, as I mentioned before, use our consumer cost lookup. Please be sure to ask me for a waiver so you will not get blocked out after your 20 searches. You can share our Reimbursement 101 topics with your consumers. Especially if you're finding you get the same questions over and over, you may want to link to a specific topic to our website. And we also have several public service announcements in both English and Spanish that we've created, and you can post those on your website as well, just so your consumers are aware of what's going on. And we also are available to create what we call a customized consumer hub. So it's our fair health information and resources on the backdrop of your website. And so, sorry, Ashley. And just here's a screenshot of what our PSA would look like that you could embed on your website.
And when you get, you'll get a copy of these PowerPoint slides, but you can just click those are live links so that you can preview what the PSAs look like.
Right. And then these are screenshots of some of our Reimbursement 101 topics that should have also been in the materials that Ashley sent you if you were not blocked by how large the files are. And so we have our Reimbursement 101 topics, but we're also able to create articles for newsletters that you may have or blog posts to provide demonstrations and workshops like this. And then any of our Reimbursement 101 topics can turn into consumer handouts. If you're finding yourself answering the same questions, it may be useful to just have it in paper to hand to people. And with our online consumer tools that a lot of people find useful, we have videos such as walking through an EOB step-by-step and explaining all of the explanation of benefits fields so a consumer can easily understand that. We have our consumer cost lookup for medical and dental. And we also have our glossaries of insurance and clinical terms to help consumers understand the lingo of health insurance reimbursement and our healthcare resources. All of these can be accessed via a free link, or we can create them for consumer organizations if you would find this useful but just don't have the time to create it. And now is a great time for questions.
Bear with me for a few minutes, guys, while I unmute you. And I think we had a couple questions chatted in, so let me just touch those first. We have a question from Mandy. Are consumers limited to 20 searches?
Yeah, so basically we license the codes from the AMA and from the American Dental Association. And so we're limited on what we're allowed to make available to consumers. So on the dental side, it's 20 searches per month. On the medical side, it's 20 searches per week per each consumer. Now, those amounts were sort of picked by the AMA for a couple of reasons. We feel that in most situations that 20 searches a week, which can include multiple codes at the same time, would cover a real consumer use of this tool. What we're trying to, and what the AMA wants to prevent, is that other more commercial organizations would be abusing the tool when they should be going directly to the AMA and licensing some of this information from the AMA. That's the reason behind it. But again, so any individual, can pretty much have good need. And then we're happy to give you guys that are supporting consumers with negotiated agreements with the AMA and the ADA that for consumer organizations such as yours, we can provide a waiver so you have the ability to help people and walk them through it.
Okay, guys, I almost have you all unmuted, so just so you know, I can hear everything that's going on in your office right now. If you don't have the phone on mute, so if you guys could kindly just just mute your phones for us and let us have a question. If it seems like your audio is still not working, just double check. The system should give you an audio pin to allow you to speak. And I'm almost done unmuting.
Yeah, sure.
Any questions, guys? I'm out of questions. You guys are going to have to talk.
I had a question. No.
Oh, boy.
So I have it's more a request for clarification.
Sure.
The 12 plans that are required to use these data are just to use it as a reference, but it's not that they are required to pay a certain percentage of the rate.
Right. They are required they're required that if they're using sort of a traditional market rate UCR approach to reimbursement, they have to use fair health data.
Okay.
Now, they may use it and they may use, they can still base reimbursement off of 70% off of our 50th percentile. That's totally up to them. Or they can, they can use our data in different ways. But if they're using market data, it has to be ours. It can't be anybody else.
And those plans can also base their out-of-network rates on Medicare.
Yep.
If they want to.
And
if they say UCR and they say it's market-based, then it has to be.
Right.
Okay. So it's not much of a protection for people.
Right.
It's not much of a protection, as you can see by some of this trend to start using Medicare. But also, on the other hand, companies covering 175 million, employees or participants are using it in some form or another. So it is being used.
And the in-network charges, you guys have that data, right? There were payments that plans do.
We have it available on some, so that module is not as robust as this medical surgical module.
So Nora asked about
Sorry.
in-network rates, if Fair Health maintains a database of in-network rates.
Yeah, so we have basically, an average that we use, and we maintain it and we use it, but we don't use it with customers because we can't trace it back to which company is negotiated rates, and every plan may have different negotiated rates. So we don't provide that to consumers, but they can go and talk to their insurance company and find out what the rate is for a procedure. Mm-hmm. So that if they're interested and they know what procedures they're going to have, they can call their insurance company to find that out, use this tool to find out what it would be if they went out of network and help them make their decision.
Erica, I noticed on the gizmo here that your hand was raised. I'm not sure if you still have a question, but you should be unmuted if you do. Feel free to ask your question.
Sorry.
Yeah, it's still raised. Erica, are you able to speak through the audio?
Are you there?
Yeah, we can
Hello?
hear you.
Oh,
yeah,
no, I didn't have another question. I'm sorry. It was just...
Yeah. That's okay. I know Sam has 4,000 questions, so we're going to let him ask another question.
Yeah, this is like a suggestion too and a question, but I think a lot of us here, at least I use Fair Health for sort of two different reasons. Our first job when we have an out-of-network reimbursement problem is we try to get all we can from the insurance company, and we fight as hard as we can to get all we can from the insurance company. Always that's the first step, but often that's not enough, and we're left at the second step, which is to go back and negotiate with the provider. Mm-hmm. And it's a really like philosophical question, what's a fair rate? But I would like, if I'm negotiating on behalf of a client with the provider, I'd be very interested in knowing what the average in-network rates are, considering that most doctors, most of their business is paid at an in-network rate. Mm-hmm. You know what I mean?
Yep. Mm-hmm. Yeah, and that's, yeah, I can definitely understand where you're coming from. And I think over time we're trying to beef up that sort of allowed module so that we can get more information. The way it is now probably would not be that helpful because compared to all of our data modules, that has the least amount of information because for really practical purposes, before Fair Health was started, Ingenix, wholly owned by United Healthcare, was running this. So companies were not about to pass their negotiated rates over to United Healthcare. So it's not very robust compared to everything else. So that is one of our goals over time, and we'll see where that goes.
Any questions out there, guys? Does anyone have any questions?
Okay, great. Thank you very much. We've really enjoyed the opportunity to talk to you today. And Cynthia's contact information is on the last slide. So if you have questions, need materials,
want a waiver, something tells me that I will receive the most interest in a waiver, and we are happy to provide that to you guys. So here's my contact information, and we would be happy to help you with any questions that you didn't feel comfortable asking, or once you leave, suddenly you think of them. So just let us know how we can help.
And guys, this is Ashley again. If you didn't receive the presentation materials, just shoot me an email and let me know. Probably the files were too huge and blew up your mailbox, and I'll be happy to resend them. Okay, great. Thank you so much, guys. It's always good to hear from you, and we'll talk to you soon. Bye.
Thank you.